there is no single perfect test protocol which will perfectly measure all of the variables that you want to look at, and every sort of protocol is always a bit of a compromise in terms of some of the values. While, for example, lactate is a signaling molecule and it affects fat oxidation, it's not the only thing that governs fat oxidation rates. VO2 max is probably quite a good indicator of our cardiorespiratory health and how well that system functions. But at the same time, when we look at substrate utilization and thresholds, we get a good measurement of the metabolic health of the individual. I like to think of base endurance and high aerobic or first threshold as a good marker also of sort of how well you're able to tolerate high workloads, how well you're able to recover from high intensity workloads. If you do exercises in different sports or disciplines, for example, you do some of the training, you do rowing, then you do a bit of running, and then you do a bit of cycling, you're going to have different threshold heart rates in all of those sports.
All right, Elias, we're live on the podcast. How are you doing?
Hi, thanks, Sean, and yeah, it's a pleasure to be here. You've had some really interesting topics and some very interesting guests on the podcast before, so I'm quite honored to be here with you.
It's great to have you on. We've had some good exchanges over Twitter. I've enjoyed reading your posts and your threads recently, and yeah, we got into some good topics, and I thought it might be a good opportunity to dig a little bit deeper over a kind of a long form conversation. So here we are. Maybe for those who don't know you yet, can you tell us a little bit about yourself?
Yeah. So, well, my educational background is in exercise physiology. I'm a master's in exercise physiology, and graduated from the University of Vascular in Finland. But now I'm also embarking on a PhD program. I haven't actually applied for the program, but we have money for the study and everything set up apart from my actual official PhD place in the program. But I think that should be fairly straightforward. But for my actual sort of work time where I'm employed is at the Helsinki Clinic for Sports and Exercise Medicine, where I work alongside with doctors. I mainly focus on sort of endurance physiological responses, so cardiopulmonary exercise test, clinical spirometry tests, and other such tests, but also at the same time as we operate as a clinic, but we're actually also the same unit pretty much is also the department for sports and exercise medicine at the University of Helsinki. So when we're doing our studies, I'm basically working as part of the research department at the university, and then when I'm measuring clients, then that's the clinic of sports and exercise medicine.
It's good. It seems like you have your hand in many different areas, and also a unique maybe outlook or perspective on those different fields. So I'm definitely excited for today's conversation. One topic I wanted to start with was about different testing protocols. There's a paper that I've read a few times now in the last few months from, I think it was Jamnik, and all looking at all the different ways to assess different anchor points or thresholds or ways to essentially measure endurance physiology, to speak very simply. And it looks like there isn't necessarily one perfect protocol to get at every single measure that we might be going towards, whether it's our first threshold, our second threshold, or critical power, and then our VO2 max. So maybe can you give us a testing protocol 101? What is in your mind the best way to get at each of those? If we take those three values or those three thresholds, if you want to call them that, as a basis for this conversation, how would you get to each one of those? What's the ideal protocol in your mind, and why?
Yeah. So yeah, that was a good intro, and the Jamnik et al. Paper is actually a very good paper that I always have my exercise physiology interns read before they start their internship at our place. So definitely recommend reading that paper, and that also really summarizes my sort of almost a mantra that I keep saying, that there is no single perfect a test protocol which will perfectly measure all of the variables that you want to look at, and every sort of protocol is always a bit of a compromise in terms of some of the values. So I forget, you said three variables, but I'm thinking you probably meant VO2 max, then maybe have thresholds, and then also probably metabolic profiling. So fat and carbohydrate oxidation are probably three things that you think you'd want to look at in a test. But they also all benefit from slightly different sort of approaches. So thinking of VO2 max first, the typical recommendation is to do fairly short protocols, 8 to 12 minutes, ramp type tests where you basically increase the load about every minute or continuously until exhaustion. And that's a recommendation for obtaining a valid VO2 max measure. But if then you want to also look at lactate thresholds, and then that's really not an ideal protocol for looking at that, because if you're measuring lactate, it takes time for lactate to move from the muscle to blood, and if you're measuring it at a continuous work rate or very short increment steps, then you're not really sure what you're measuring there, which workload is it reflecting.
In your mind, is there a minimal length that we should apply or use when we're doing lactate measurements? What I forget the name of the author. I think it was a 2018 paper that looked at different step lengths and the response in lactate increases. They seemed to say that 4 minutes was the bare minimum that you wanted to use in terms of duration. Would you agree with that? Would you go higher, lower?
Well, we actually do quite a lot of testing with 3 minute steps. Okay. But if I was looking only at lactate thresholds, then I'd want to go longer, maybe 4-5 minutes. Actually, something that's worth pointing out there also is that for lactate testing, the step length is not the only variable that matters. It's also how much you increase power or pace between steps.
Okay, can you say a bit more about that? That's interesting.
Yeah, definitely. I forget the authors, but there's a very nice paper from I think it was maybe late 90s, but it shows basically that the larger increments that you have in power, the longer steps you're going to need for you to have a reasonable estimate of a lactate steady state or a representative lactate number at the end of each step. As a rough rule of thumb, what I got from the paper is that if you're doing 40 watts increments, then you want to do 5-minute steps. For 30 watts, it's about 4 minutes is okay, and if you're doing 20 watt increments, then 3 minutes is okay. So that's a sort of fairly nice rule of thumb there for operating with lactate testing.
Okay, so since we're on lactate threshold 1, let's stay with that for a minute. We already have a lot of variables playing here. We have the magnitude of increase between one step and the next. We have the length of the steps. Now, can we talk about the method that we apply to determine that first threshold? So maybe before we talk about different methods, whether it's a baseline plus some value or a log or other methods that exist, if we think from first principles, what are we trying to achieve when we're looking for that first threshold? What are we trying to extract from the data, and from that maybe line of reasoning, what would be the best method that we can apply to determine it?
Well, sort of to put it simply, what we're trying to look at there is, I think, the first significant change in our metabolic pattern or response to exercise. And what I mean by that is that it's in terms of lactate, it's the first time that the shape of the curve, or it's not always a curve, it can be a bit of just a linear line in some cases, but the first time you see a significant change in the shape, indicating that there's a shift going on in sort of how you utilize your metabolic pathways during exercise.
Would it be so? It's always hard to look for a kink in a curve, right? As we say, but then we also, would you relate that change in shape to the same change that we might see if we graphed VE over VO2 or ventilatory equivalent over VO2? Is that the same kind of inflection point that we're looking for? So like you said, a change in the way that the body responds to the different intensities?
Yes, and if you look at both lactate and ventilatory thresholds, then both of them are basically looking at or trying to figure out the same physiological phenomenon, but you're just looking at it at sort of different levels of measurement. Mm-hmm. and they have a lot of similarities in that ventilation or changes in the ventilatory pattern and lactate response are largely governed by the same factors, but there's also some factors that aren't directly linked to each other. But yeah,
that makes sense. So let's talk about we look for a change in trend, let's say, on that lactate curve, if we want to call it a curve, even though we don't have continuous measurements there. Now, can you talk about the relationship between that change, that inflection point, and what's going on from a substrate utilization standpoint? If we're talking about fat max and then lactate threshold 1, how do those relate? Are they close? Are they not so close? Can they be different from one person to the other?
Yeah. So here, I would first of all, I would refer to the 2018 paper by Inigo Milan and George Brooks, where they look at both lactate response and substrate utilization response in both very fit individuals and moderately fit and those suffering from a metabolic syndrome. Mm-hmm. And on a large scale level, we see that the change or the initial increase in blood lactate concentrations and corresponds fairly well to decreasing fat utilization and increasing carbohydrate utilization, and that would be quite sort of understandable given that increasing lactate levels signal the fact that our glycolytic flux rate is increasing at a relatively faster pace than oxidative phosphorylation is increasing, meaning that there's sort of some of the lactate starts entering blood and starts appearing at an increasing rate there.
Yeah, I guess it does make sense as well from a signaling standpoint that minimum lactate would match up with maximum fat oxidation. If we think about lactate as a signaling molecule that's going to essentially tell the body to not release as many free fatty acids and not oxidate them either. Yep. One thing I've seen as well that's interesting now that I can correlate the lactate data and the muscle oximetry data, what seems to happen is that there's a let's say a visible decrease in muscle oximetry, or as measured by a MOXY, so as a percent as SMO2, because I know not all NIRS devices measure in the same way, but if we look at SMO2 from a MOXY, what you would see is that when lactate starts to rise, you would see a significant decrease in the oxygen saturation at least in the locomotor muscles, which also makes sense from a fat oxidation standpoint, since we know that myoglobin is preferentially going to transport free fatty acid if it's bound to oxygen, right? So the more oxygen we have available, the better we're going to transport and then utilize that fat as well. So all this seems to make sense. Lactate minimum, max, fat max, and then oxygen max as well. Does that kind of hold from your standpoint?
Yeah. I think that's at least on a general level, it holds very well. But as you probably might have seen, I've also pointed out to the fact that in some cases, the lactate thresholds and fat oxidation can be quite wide apart from each other as well. And I think that speaks to the fact that while, for example, lactate is a signaling molecule and it affects fat oxidation, it's not the only thing that governs fat oxidation rates. And there are also independent mechanisms at play there.
Mm-hmm. And so when would you usually see I don't know even want to say a decoupling because they don't necessarily have to be coupled, but when would you see a big difference between lactate threshold 1 and fat max? Is there a certain population that you might see it in, or a certain demographic?
I'd say that it's more common for the less well endurance trained individuals, and also I think that there is something to think about in terms of how each individual's diet looks.
Okay.
It seems to me that often when I see surprisingly low fat max levels compared to the first lactate threshold, say that first lactate threshold occurs at 65% of VO2 max, but then I see a fat max at about 40% of VO2 max, and those are quite close to actual numbers I see in testing. Quite often when I inquire said person about how they feed well during the day, but also how they feed during their training sessions, as it's quite common that they sort of adopted the idea that when you're doing endurance exercise, you should be feeding carbohydrates at during all sessions at all times, no matter the intensity or the length of the training session.
Which is gonna go ahead.
Yeah, meaning that they've trained their body to basically utilize carbohydrates very efficiently, but they're at the same time they're quite inefficient in turning on their fat oxidation because they don't really have to, and I think our body is maybe a bit lazy in the way that if it doesn't have to switch on fat metabolism, it won't do so because it's sort of it's a more costly way of producing energy for the muscle contraction.
Yeah, that makes sense. So I don't want to get too far into the weeds and try to stick to our testing protocol. We'll come back to training interventions a little bit later on those different topics. So we were talking about VO2 max. You mentioned the fact that a shorter protocol might lead to some true values or some values we can rely upon, whereas longer steps, longer protocols might underestimate VO2 max. Do you know to what extent that underestimation? What can it look like if I'm using 3-4 minute steps? How is my VO2 peak on that test going to relate to a VO2 that I measured on a GXT1 where we have 1 minute steps and we increase pretty fast and we reach volitional failure within, like you said, 9 to 12 minutes?
Well, this is something that's actually very good that we're getting into, because I started by stating that 8 to 12 minutes is the recommended time, but I actually think that for fit individuals, 20 to 30 minutes is just fine. The compromise to the VO2 max level you reach is minimal there. If you look at the evidence for the 8 to 12 minute protocol, that mainly comes from testing sort of hospital patients and clinical patients who are really quite unfit individuals, and there I understand that in their case they need shorter protocols, but for endurance trained individuals, slightly longer protocols shouldn't be a problem. And just like consider that you do a normal VO2 max training session, you probably warm up even quite intensely for 20 to 30 minutes before starting the actual sessions, and you think that you're actually going to reach a higher VO2 level after that warm up than before that warm up. So to some extent I think we are overplaying the effect of the test duration on VO2 max. That said, there are certain limits at which you do start noticing effects. I have my sort of own individual N=1 experiments on the topic where I wanted to look at. I did a VO2 max test on myself using 1 minute steps and 20 watt increments. Then I did 3 minutes increasing 30 watts every 3 minutes, and then I did 6 minutes increasing 30 watts every 3 minutes, meaning also that as I was lengthening the stage length, I was sort of halving the number of power I was increasing per 3 minutes, and there my results for me were that I reached pretty much exactly the same number on the 1 minute and 3 minute protocols. One took maybe slightly below 15 minutes, and the one was slightly above 20 minutes, and they were within a few, I think, centiliters.
Okay.
So well in sort of looking at what the sort of typical measurement there for the device would be. So they were very closely matched. Then when I went to 6 minute steps, for me that was probably a bit long. I ended up reaching, I think that was about 300 milliliters lower values for my VO2 max than I did on the shorter tests.
So there might be an argument there, like you said, that fitter individuals can use longer steps. Now, would there be, besides the warm-up component that you mentioned, would there be any other added benefits to using longer step tests if we want to measure VO2 max in that case?
Well, I think there is a slight benefit in that the VO2 values will maybe correspond a bit better to the power or pace values that you're getting from the test. Although this is again a bit tricky, because also when we're considering the effects of step lengths and how and why we choose different types of step lengths, often the reasoning is that we want to achieve a steady state, like physiological steady state responses at each end of each step. But if you think about that, then I think that's a bit of a flawed logic there, because you're only, if you look at where you're going to achieve steady state responses, that's only below the first threshold. So only when you're in the moderate intensity domain is the achievement of a steady state even physiologically what's going to happen in your body. If you go to the heavy domain, so between the sort of two thresholds, there's going to be there's going to be a slow component, even though the magnitude is small. There's going to be a slow component to VO2. If you look at lactate numbers, you probably reach something like a steady state at maybe 10 minutes into the exercise. But even if you look at the MLSS, so maximal lactate steady state criterions, they look at the lactate increase from 10 to 30 minutes, for example. And while the idea is that there is the increase stays below 1 millimole per liter, to me that signifies that there is still a bit of movement there often. Same goes for heart rate also and for many of the other variables. Now then, when we move from heavy to severe intensity, we're not going to reach a steady state at any point. That's the definition of zone, and you don't reach a steady state there. So from that point of view, saying that we do X length steps because we want to achieve a steady state, that only holds true for the moderate intensity steps. Yeah,
I totally agree with you on that. I've been using, and I started, I want to say backwards. I don't think backwards the right term, but I essentially got into the field of exercise physiology. I don't have any formal training in it. I'm just very interested, and I'm trying to digest everything I've been able to find from Mark Burnley's YouTube channel, from articles, from books, and from Twitter. It's actually quite a good resource if you follow the right people and you ask the good questions. And what I started using the Moxy only, right? I had a Moxy, and was kind of my intro to, we can look inside the body and see what's going on. And they were using some fairly long steps. They were using a protocol called 5-1-5. So 5 minutes on, 1 minute off, 5 minutes on at the same power output, and then increase for the next 5-1-5. I've modified that over time. Now I've come down to 4 minute steps with 1 minute rest. The 1 minute rest I find interesting. One, now that I take lactate, it's always nice to have the person stop for a minute. Two, it also gives you a look at the reoxy slope on the Moxy, which I find very interesting. And we can maybe get into that in vascular control a little bit later. The other thing that I found is that, and as we probably know, the kind of the onset kinetics from a stopped start, it takes 90 to 120 seconds for everything to kind of balance itself out. So it's not per se a steady state, right? But once you get to about 2 minutes, from a RPE standpoint, you know what you're going to be feeling for the next few minutes. Before that, you're just getting started, really. So I find 4 being a kind of a happy medium, because you still get 2 minutes of, it's not steady state, but it is a balance between that delivery and utilization components, which does seem to give some interesting information. But like you said, there's always a compromise somewhere when picking the right protocol.
Yep.
Now, if we go to threshold or threshold 2, MLSS, critical power, many different names, many different methods to get to it. What would be your main considerations when trying to determine threshold? I actually, we were having a chat on Twitter just a few minutes ago. I did a little session today. So maybe I'll give you my version and then you can comment on it. It's not even my version. I think it's just from a simplicity standpoint. I've been very interested in the practicality of the 2-test critical power application. So a 3 and a 12-minute test repeated multiple times. So we have accurate measures of the person's capacity on those time efforts. And then obviously work them into a graph, get the slope, get the y-intercept, and get a measure for critical power and W prime. So I did mine last week. I did again last week. I got to a 284 watt critical power and a 24 kilojoule W prime. And I did a step test on myself as well last week with the 4-minute, 1 minute off, and calculated my lactate threshold 2 with the modified Dmax method applied to the xphizlab.com, I believe, and you can input your values, and they give you all the different alternatives that you can use. And there I was around 258, I believe, 258 watts. So how to decide which one should I use when I'm planning sessions? I did a threshold session today, so I kind of went bang into the middle, 270 watts. My lactate reading was fairly high. So what does that tell me? Was I too high? Was I too low? Should I try and do the same one again and measure VO2 and see if I reach a steady state? Maybe help me a little bit with that second threshold here in that context.
Yeah, I think first of all, I think we can dissect that question into 2 parts. I think the first thing is or consideration here is that you have an idea that you want to target certain kinds of physiological responses, and you're using different threshold concepts to get at those levels. Now, the second consideration is that you're probably targeting certain physiological responses because you want to achieve certain training adaptations out of the session. And I think we need to consider those two separately. I think there's more, or sort of on the level of strength of evidence, we have more evidence for the different threshold concepts and for our physiological responses of what's going to happen in our body. We probably need to be a little bit less careful when we're saying that this type of training session is going to definitely achieve this kind of training adaptation, in terms of just like, in my opinion, the number of scientific studies and their qualities and the number of mixed results you see. I'm quite hesitant to say that in order to improve your second threshold or critical power, you need to do these types of sessions and they will improve it. But if you do them, you have to do them slightly below. If you go above, they're not going to improve. I don't think that holds true. I think you need to be a bit more flexible there, and just recognize the fact that we have quite a lot of limitations to our knowledge in terms of how we actually achieve different kinds of training adaptations. But if you go back to the original, the first question is looking at that you probably wanted to achieve certain kinds of physiological responses and in a threshold session. Typically you might be looking at, as you might be looking at blood lactate levels, and that tells something about the level. I'd say that in terms of the blood lactate numbers, you'd probably want to be around the sort of absolute value that you've tested as your lactate threshold value. So say you've tested that your modified Vmax is at 3.5 millimoles per liter, you probably want to be somewhere from 2.5 to 4.5, and also see a fairly steady response from one interval to the next. For looking at heart rate response, then again, in threshold sessions where if we're doing them in the heavy intensity domain, while there is a slow component to VO2, its magnitude is not particularly large, and the slow component of VO2 should be reflected in how heart rate acts during exercise. So also in terms of heart rate, you'd want to see an initial rise but then reaching fairly stable values, which then don't increase that much during the intervals. Say if you did 8-minute intervals, say from 5 to 8 minutes, there's an increase in heart rate, but it should be relatively modest. If there's a continuous increase in heart rate and you see that you're not reaching any steady state responses there, then you can reasonably assume that you're not reaching any steady state in the oxygen consumption either, meaning that you're eliciting severe intensity responses in your body.
Okay, that all makes sense to me. I was just pulling up my data while you were talking from last week's step test, and I'm actually at 8.1 millimoles on that 275 step. And so if my lactate threshold 2 is a little bit below, then I probably should have been a little bit underneath that during the effort. How much does heat impact heart rate on an effort like this? I'm on my Concept 2 bike erg. I'm indoors. I didn't have great ventilation. I didn't turn the fan on. I just thought, what? I don't always need the fan on, so I didn't. To what extent, if you had to hypothesize, had I turned the fan on, had it been cooler, or had I been outside, would my heart rate have responded differently potentially? Would my lactate have changed, or was I just maybe a little bit too high on that one, and I could pull the power back 20-30 watts on the next session?
I think that the heat element is definitely something to consider there, especially as I think that you mentioned that is also being quite a sudden change in the sort of how warm it is.
Yeah, it's pretty much summer now, and it wasn't a week ago.
yeah. So that's also the heat itself is a factor, but also the fact that you haven't yet given your body time to acclimatize to the new environmental conditions. Increased heat is definitely going to be driving your heart rate up, and we know that there is a fairly good correlation in terms of heart rate and lactate, and they're both representations of the internal workload that your body is going through. So maybe if on another day at the same power output you see much steadier heart rate responses, your body's you're cooling yourself down better, or ventilating better during the exercise, you'd probably also see lower blood lactate values and lower RPEs. Okay.
From that standpoint, if we go back to the question number one that you kind of framed there from my starting point, do you have a preference? Let's say all options are on the table. Somebody has access to lab testing. Somebody can do a critical power test as well. What would you use and why? And then second question to that, if somebody does not have access to lab testing, but they still want to try and get the best estimate of where that boundary between heavy and severe stands for them so that they can organize their training, what precautionary notes would you put onto that critical power measure if we wanted to use it to determine intensity or training of intensity as maybe in the kind of zone 3, 4, and 5 area?
I'd definitely want it. So if we have both option for both lab and CP critical power testing, I definitely recommend doing both. I think they both bring value to the table in terms of determining your training. Lab testing, critical power testing is a very good way of looking at what happens at the upper end of the heavy intensity domain up until sort of severe intensity, maybe even extreme intensity domains. It's a very good way of looking there, predicting performance there, and also it's a very good tool of understanding how even marginal variations in power output can really drastically affect the time that you're able to hold the power for.
Mm-hmm.
And you also get the determination of the W prime sort of work capacity above threshold. I think those are really good tools to have alongside lab measurements. When I have both options on the table, I like to look at how well the numbers match each other from both of the tests. I'd say that mostly when I determine thresholds, they're quite well aligned. So I normally look at both ventilatory and lactate thresholds. They align quite well with a critical power. I try to be honest in that I first determine the thresholds myself and then ask what their CP number if they have it. So I'm not cheating there, but I think mainly they hold up quite well with each other. In terms of
sorry to cut you off. What would be for you an acceptable range between the two? How many % are we talking between, let's say, an LT2 that was measured on a step test with lactate measurements, and then a critical power measured on the field with 2 or more tests?
I think sort of in the range of 10 to 20 watts is within acceptable for me, mm-hmm. and reflects the fact that we're measuring the thresholds in slightly different ways, and also just the fact that we have physiological variation from day to day also.
Mm-hmm. Okay, yeah, that makes sense. Would you also say that is, from your experience, is critical power consistently above LT2 when you have both access to both measurements?
Maybe mostly it might be, yeah. If I were to think which number was higher, then maybe it would be critical power, mm-hmm. mostly, but there's variation there also.
Okay, interesting. Okay, so we've covered VO2 max testing, LT1. We've talked about threshold 2. Now, if we were to think about a different population, we often talk about well-trained populations, elite athletes. Now, if we want to be testing unfit populations, what measurements are important, and how can we attain them in the, I guess, safest way possible?
I think for the unfit populations, what we could be doing a much better job at is giving them good anchors, good submaximal anchors for their exercise intensity, good anchors that match with physiological responses in the body. There, I think we're sort of dropping the ball if we keep using. First, we calculate age-predicted heart rate max, which is off by a small or quite large number, and then we calculate the set percentage of that, mm-hmm. and we're really at a danger of giving, if we say we give 70% of heart rate max as a workout to two or a group of 10 individuals, say, we're going to have people who are in the moderate intensity domain. We're going to have people who are in the heavy intensity domain, and some unfortunate individuals are in severe intensity domain, so mm-hmm. above their second threshold. And then we're wondering why these people are adapting so differently to the exercise, why this training is working for some and it's not working for others. It's quite simple to answer, in my opinion, is that they're doing completely different workouts.
Yeah, which makes total sense, and which is why this testing is so important beforehand, so we can actually determine where an athlete or a person needs to work to elicit certain adaptations, or at least have a certain physiological response that we're looking for. So are you talking about those essentially the same anchors that we were just talking about before, threshold 1, threshold 2, yeah. and a VO2 max? Yeah. And to an extent, I feel that these kinds of tests are often more valuable to the less trained individuals, in that well-trained individuals are
normally fairly good at identifying where they're at, and they have also fairly predictable responses. When I was mainly testing well-trained athletes myself, when I was coaching rowers, I think that a variation of if one person had 70% of VO2 max as their LT1 and the other one had 75, I was like, yeah, there's something that we really need to work on and look at. But now that I've moved to testing sort of whole population level and testing both elite endurance athletes and very unfit individuals, the first threshold can be anywhere from 20% of VO2 max up until 80. And that's the sort of range that I've seen in tests, and try to look at that there's both in terms of ventilatory and lactate thresholds.
That's really a huge range. So it's like you said, it's important for every person to get access to those measurements so that they can train at the appropriate intensities. Do the protocols that you would use for unfit people, would they change from the ones that you might use for more elite populations? We talked about the shorter, maybe the GXT1 for VO2 max. What might you do for a lactate threshold, for example, or lactate thresholds with unfit individuals?
Well, here again, there's sort of different considerations. So if you look at the VO2 max number, unfit individuals probably need shorter stages for that or shorter tests for that. But on the other hand, they also achieve metabolic steady states lower than fit individuals. So in a moderate intensity domain, a well-trained endurance athlete achieves a reasonable steady state in 2 to 3 minutes. Whereas for an unfit person, it can take up to 6 minutes. So basically we have two opposing directions in terms of what we would like to do. And again, it's sort of coming back to what would be reasonable for them. That's also the consideration that you need to start at very low intensities to test those individuals. So typically for males, I'd start the first load is 30 watts, and for females it can be 20 to 25 watts for the initial load, meaning it's basically going as low as you can set the bike erg to. In terms of resistance control. With unfit individuals, I'd probably lean slightly more towards using ventilatory thresholds. I also measure lactate and I look at lactate thresholds, but first of all, they often lack a sort of distinctly curve-shaped lactate curve in that it can just sort of keep on increasing at roughly the similar rate throughout the test protocol, and identifying breakpoints there is sometimes a bit you don't really see proper breakpoints there. But with ventilatory thresholds, you usually see a quite clear threshold responses there. The added benefit to looking at ventilatory thresholds is that they are much less protocol dependent, in that you're going to get your ventilatory threshold values at the same VO2 numbers, irrespective of the ramp rate you're using. Okay. Unless you start using very long steps, and there you get to the point where it can be a bit hard to discern ventilatory thresholds. So
would you say that ventilatory thresholds are useful in those populations because of, or in partly because of the fact that they might be more sensitive to CO2 increases than more well-trained populations? Is that a factor that we have to consider when looking at how somebody changes their breathing relative to increases in power output?
Yeah, I'll just try. Let me think about the question a bit. Yes, well, in terms of sensitivity, I think we can approach this from the angle that basically that sort of chemoreceptors are sensing hydrogen ions, so acidity, and they're sensing potassium and a number of other things. In terms of CO2 levels, what you do see in unfit individuals is that throughout the test, they or especially in the sort of so-called isocapnic area, so where your arterial CO2 pressure is stays the same. You see that's at a lower CO2 level. So the arterial partial pressure for carbon dioxide for them might be somewhere in the range of 35 mmHg. Whereas for fit endurance trained athletes, they have much more carbon dioxide in their arterial blood. It can be up to 50.
Yeah, right. Which is a big difference. Okay, so we have ventilatory thresholds that we might want to use preferentially for unfit individuals, maybe those shorter steps to get to a VO2 max. Now, if we talk about interpreting that data, we've collected it. We have it successfully with the best available protocols, depending on the person that we're working with. Now, you talked about the unfortunate nature of the name VO2 max test, because that's not necessarily the only thing that we want to get out of it. So from your perspective, what are the useful information that we can extract from the different tests and different protocols that we talked about up until now? What should we be looking at?
Yeah. So first of all, when we're measuring VO2 max, obviously depends a bit on the type of devices you're using. So for example, is your VO2 device, does it measure oxygen consumption as well as carbon dioxide production, or only oxygen consumption and ventilation? But if you're looking at the sort of metabolic cards that for example we use, we get a range of measurements from the device, giving you an idea of said individual's maximal aerobic capacity VO2 max, but then we can also look at their substrate utilization, how good they are at utilizing fat and carbohydrates. There, I think, and we can and this is sort of linked also to the threshold concepts. There, I think we can sort of look at it from two perspectives, in that VO2 max is probably quite a good indicator of our cardiorespiratory health and how well that system functions. But at the same time, when we look at substrate utilization and thresholds, we get a good measurement of the metabolic health of the individual, and you can have individuals who look in terms of their VO2 max values, they look very healthy, but their metabolic control is completely lacking. That's quite typical in sort of, or quite typical is maybe overemphasizing it, but it's not uncommon in sort of very high intensity predominant sports where practice of the metabolic control is maybe lacking.
Would you have some practical examples? CrossFit comes to mind, and it's not to bash CrossFit. I love the sport and everything that they've done so far, and there's definitely better ways to train for the events and worse ways to train for the events, but definitely something I've seen working with more and more, especially kind of higher level amateur athletes, where they don't really have it's not part of the culture, first and foremost, to actually do some low intensity work, and some minimal amount of low intensity intervention actually has some big returns, which should tell us that with the amounts that they're training, they probably need a lot more of that if they wanted to get the full potential out of themselves. But maybe I'll let you expand on what sports you see that mostly in.
Yeah. Well, CrossFit is a sport that I had in mind, but I also don't want to be too critical of it. Especially currently, I see many CrossFit athletes who are training very intelligently in terms of their endurance training, and their profiles look really nice. But I guess it's, well, there's the thing about any sort of training is that if you look at sort of at a whole population level and at CrossFit, first you have a lot of cross adaptations, and basically anything you do will improve you. Strength training will improve your endurance training will improve your strength. But as you move further and further up the sort of fitness ladder, you need to be looking at more specific types of workouts to improve your fitness. You need to really start to specialize not just in endurance and strength, but also in sub determinants of endurance performance and sub determinants of your strength performance.
Mm-hmm.
And there I think is the sort of issue is that as the sort of initial say the initial 6-month period, people get a lot healthier, a lot fitter in a sort of typical sort of CrossFit box type sessions that's mainly high intensity and combining basically strength, plyometrics, endurance into the same workout. But after that period, they start sort of plateauing, and it's a time, in my opinion, when you should be looking at sort of specializing your training more. And in terms of endurance training, it means that all training cannot be high intensity training at the time. Yeah. In terms of profiles I see there is that they have reasonable numbers for their VO2 max. They have reasonable numbers for their maximum power output or maximum running pace, but very low threshold values. So in a well-trained endurance athletes, I look at the first lactate or ventilatory threshold to be around 70 to 75% of VO2 max, even 80% of VO2 max in some cases for long distance athletes. In CrossFit athletes, it's not uncommon for me to see, say, 40% of VO2 max for the first threshold. And there also you see that blood lactate starts increasing very early on. It increases at quite a steady rate, and surprisingly, actually, normally think that as a high intensity sport they'd reach high blood lactate values, but they actually don't, because I think they've sort of trained in the sort of moderato area a lot, and that they're not particularly efficient at either producing blood lactate at high rates or removing it very efficiently either.
Yeah, it's the saying that comes to mind is medium works in clothing, not in training. And it's obviously, I don't want to dive into the whole polarized versus other kind of intensity distribution approaches. There's been a great podcast recently on that triathlon podcast with Mark Burnley for anybody who wants to dive into those ideas a little bit more. But it is interesting, especially for CrossFit, that says to be high intensity, where, like you said, if you try to push high intensity too much, you're actually going to get kind of just pushed down to the middle, and you're not actually going to be able to go that high, and then you like the bottom end as well. Okay, so those are this is one sport. Is there other sports that come to mind when you look at fit? Maybe let's talk high VO2 maxes or decent VO2 maxes, but low relative threshold values.
Well, it's also typical in some sort of team sports often, that I see those types of values. And there, what's also interesting is seeing the seasonal variation in those values. So, for example, I've been testing ice hockey players at the end of their season. So their season lasts maybe from September, October until say March, and we're testing them at the end of the season in March, and then we're testing them before their next season starts, say in August. And it's really interesting looking at what happens between those values or those testing points, and try to factor in then on what's been happening in their training. So what I often see is that after a season is finished, their high performance is relatively good, but they're undermining their base endurance quite a lot. In that we see quite low threshold values again in those instances. And then when they do their summer's training and maybe hopefully focus a bit more on also their base endurance, then we see a much improved base, but also nice high intensity numbers there. So we're not compromising that. What I think again is happening there is that if they have maybe one or several games per week, and then they have their their sports specific practices for several times of the week, and basically all of those sessions are mostly sort of interval type efforts where they go relatively hard, rest, go relatively hard again. There's very little of the sort of moderate or intensity work going on there at all. The thing I think why this is also important, so someone might say that, okay, well, what do they need a high first threshold for? I mean, they're not operating at that intensity during their games. Why is it relevant for them? I like to think of base endurance and high aerobic or first threshold as a good sort of marker also of sort of how well you're able to tolerate high workloads, how well you're able to recover from high intensity workloads, how good quality sessions you're able to do on say several times per week. So while it might not affect the performance directly, it has very big indirect effects on the performance. And actually, when we get athletes who present with symptoms of sort of typical for overtraining, so poor performance, lack of sleep, mood disturbances, etc. It's very, very common for them to have a low aerobic threshold or low first threshold, and that's where we actually see the most. That's the most occurring finding that we have there in that they can maintain nice high intensity numbers for quite a while, but you just start seeing that every time they start walking or even slowly running, they're going into quite a high gear in terms of their metabolism, and it's quite stressful for them.
Right. So everything becomes stressful and you can't recover from it anymore. I can relate to what you were saying about the tolerating higher loads, higher volumes of high intensity training with, like I said, a few CrossFitters I've worked with, and even just recommending to them to do 1 to 2 hours a week of low intensity training on a bike or on one of those assault air bikes or Rogue Echo bikes. They have so many now. Just a couple hours a week, and within 8 to 12 weeks, I had feedback about better sleep, getting to Friday and not being completely fried by the week, and being able to actually throw down on Friday and tolerate the weekend well, and just recovering better between high intensity bouts. So lots of benefits from seemingly a very small volume of this type of work, but I think it speaks volumes, no pun intended, to the importance of this kind of work and having the metabolic flexibility of I want to be able to be efficient. I want to work this side of my metabolism, but then I can also generate high power, but then come back from that state of stimulation, if I will, or sympathetic drive, come out of it and recover quicker.
Yeah, I think there's well you can look at these things from a number of perspectives. You can look at them from a metabolic, hormonal perspective, but for me one of the most useful perspectives to look at this is the autonomic nervous system and how it balances itself. So there, as I think you well know, is that we can basically think of our autonomic nervous system. I like to think of it, we have the parasympathetic and the sympathetic activity, and they're basically, it's like they're pulling a rope from either end, and whichever is pulling, the sort of how strongly each of them pulls determines where the sort of where you're at. And now if we start to think about what we know about how operating in different intense domains affects our autonomic nervous system, I'd like to see more studies on this, but there's a very nice study from Steven Seiler's group where they looked at the effect of performing work below the first threshold, between the two thresholds, and above it, and what they found out there in that particular paper, they looked at quite acute responses. So I think it was like 2 hours after post exercise. So really quite acute responses there. Mm-hmm. But what they saw is that doing exercise below the first threshold, your autonomic nervous system recovers from it very quickly, and there can even be a bit of an overshoot in terms that your parasympathetic activity gets stronger as a result. You might see even increased heart rate variability numbers after a said low intensity or moderate intensity bout. But when you go above the first threshold, you start seeing stress responses in that your sympathetic nervous system gets activated, and the threshold systems they did weren't particularly demanding, in my opinion. They were like, I think 3 by 10 minutes and at an intensity that was between the two thresholds. So it was not 3 by 10 minutes at the second threshold, but well, sort of between. So very sort of what you'd consider quite sort of still quite manageable workouts, and something that you could easily do day in, day out for a while and think that it's not too stressful, but you're sort of constantly stressing your sympathetic nervous system there and not getting the parasympathetic nervous system as strong as it should be. So yeah, that's what I like to think and offer as a good sort of explanation tool that I think a lot of people can understand quite well. Also, when we look at tests in terms of, we can see that if they're sort of quite sympathetically activated individuals and there's a bit of overactivity going there, their heart rates shoot up quite quickly, even at light intensities. Their heart rate decline or decrease after the test stops is very slow. I've had individuals who have lied on the bed for 10 minutes and their heart rate is still at 110, 120, 130 beats per minute, and it's just not decreasing. We'd like to see it well below 100 beats per minute at 10 minutes after the test, if we'll just put them back lying down immediately after they stop cycling or running. And these autonomic disturbances are something that then also relate to sleep and pretty much everything else that's going on in life.
Yeah, that makes a lot of sense. Now that we talked about testing, looking at the data and how to use it for different people, if we talk about training, and just for the sake of time, I want to focus on those quote unquote aerobic adaptations. So let's talk moderate intensity domain. We're talking fat oxidation. We're talking, like you said, parasympathetic dominance, something that's beneficial for the nervous system. Obviously, you can overdo it, but you'd have to really work really hard at it. But what considerations do we need to have in mind if we're talking about improving those responses for people, whether it's for health or performance? So let's cover the whole spectrum. If you have somebody who's unfit, metabolically unfit, what kind of interventions are you going to prescribe to them in terms of frequency, in terms of volume, in terms of increase per week? And then on the other end, if we're talking about athletes, maybe we can draw the distinction there between athletes that are in endurance sports or athletes that can benefit from endurance qualities for their sport. And maybe so talk about those three populations, if you may, when it comes to let's say improving our metabolic efficiency and our endurance. So for if we start with the less fit individuals, I think this is something that I'm going to be reiterating for all of those populations, but training below the first threshold is really key for them from several angles. First of all, to make sure that they can get into a practice of frequent training. We don't want to overstress them. They're also quite poor recovering from sort of stressing exercise bouts. There, I think it's to get them into a frequent habit of training is starting from incorporating some sort of training. I'd say 3 to 5 times a week that they can do below their
below their first threshold, and we know that this is going to improve their metabolic health. We see vastly improved metabolic control. We see vastly improved fat oxidation rates. After that, we see nice increases in threshold numbers there also. But we also know that if an unfit individuals, when they train, they don't need to train at a particularly high intensity to improve their VO2 max. Mm-hmm. That we know that for unfit individuals, even training at below 40% of their VO2 max is going to improve their VO2 max. So mm-hmm. so it's going to improve a lot of numbers there, and it's going to hopefully make them also feel a lot better. I know that there is a bit of a debate going on or I'm not sure if it's a debate, but the idea is that why we want to sell high intensity training is that they're time limited individuals, and with limited time you get more bang out of your buck by doing high intensity training. Often, but there I think we're not considering in the fact enough that high intensity training can be quite unpleasant also. So for many individuals, it's a huge relief to hear that the training that they need to perform isn't even something that actually considered training. It's going for walks and putting on, listening to music or podcasts and walking around. That's typically for if you haven't done much endurance exercise, walking intensity is where you're going to be at when you're doing your light or when you're training below your first threshold. Mm. But with that being said, I wouldn't shy away from doing high intensity work. Just do it in a controlled manner. Do it once per week maybe. So I like to have sort of rules that if you're doing 2 to 3 moderate intensity sessions, then you can add 1 high intensity session. If you really want to do 2 high intensity sessions, I'd want you to earn those 2 high intensity sessions by doing 5 to 6 moderate intensity sessions first. Mm-hmm. And sort of earning the higher intensity sessions is, I think, a key for pretty much everyone.
Yeah, if we all did that, if we respected that, to earn your high intensity by doing your low intensity and then earning your carbs by doing exercise, I think we're the population at large would probably benefit from those tenets greatly, I think.
Yeah.
So now if we talked about the unfit and how we might want to help them get fitter through these types of training interventions. So now let's talk about the athlete. Let's take the case of an athlete who's not in an endurance sport. Okay, so it might be more of a power-oriented sport. We could say CrossFit, for example, or another. So obviously, there's a huge endurance component, especially as the level goes up. The competitions are longer. There's more events, so you have to be able to tolerate high workloads over 2, 3, 4, sometimes 5 days. How would you approach training interventions around volume tolerance, fatigue resistance, and metabolic efficiency for those type of athletes if you were to work with them?
Yeah. So for CrossFit athletes but also for many team sports and many and even I'd say you could look at even some sort of speed or strength based sports. My sort of understanding and the message I try to relay to the athletes is that for them, I'd see that actually performance wise their base endurance level is more important for them than their VO2 max level in many cases, in that there, as I said before, a good level of a solid aerobic base and a solid aerobic foundation just allows you to tolerate higher workloads, allows you to do more high quality training in the things that you actually need to be doing high quality training in. Mm-hmm. in those terms, I'd say that it's a good idea to target that, but also because I think that it's quite nice in the sense that well, you have to invest time to it, so you have to invest training time, but because the sessions are not particularly stressful for them, it's not going to negatively impact and there are other aspects of their training so much. So say you want to develop speed, well, don't go doing huge volumes of sort of like endurance training, but doing several, say 60 to 90 minute sessions a week at a light intensity is probably not going to harm your other work that much. It's not going to make you tired. So for the other sessions, meaning that you don't get as much out of them. Also, well, this is a bit more speculative, but if you look at the sort of signaling pathways and how you activate different signaling pathways in exercise, we know that high intensity endurance training elicits mitochondrial biogenesis by activating the PGC1 alpha route by activating the AMPK route. And AMPK route, so adenosine monophosphate kinase, is mainly activated in high intensity bouts. At the same time, we know that AMPK activation serves as an inhibitor for mTOR activation, which is then something that we'll be looking to activate if we want to increase our strength and muscle size, for example. So in those terms, the high intensity endurance training is going to make you more tired, but might also negatively affect the sort of signaling pathways that you're looking to achieve in other workouts. So you have to consider those types of workouts more carefully when you place them in the year. So what I'd say for example for CrossFit athletes is that they should try to have a good amount of moderate intensity training below their first threshold throughout the year. And it's an aspect of their training that doesn't need to change that much. It's more important that they do it consistently around the year. And as it's not going to affect what the other things they do so much, then that's also a reason they can maintain it throughout the year. However, when they specifically need to improve their endurance performance, then definitely I'd have them do high intensity sessions as well.
Right, but that might be away from other types of trainings or other focuses that, like you said, might be going against or competing for certain signaling pathways, or at least not be conducive to those adaptations. Now, before we go to the purely endurance sport athletes, you said those moderate intensity domain bouts, they can be fairly long, 60, 90 minutes. Multiple times a week. They're not very stressful if they're done at the right intensity. So if you have measured a first lactate threshold, for example, for one of those athletes, what recommendations are you going to give them? Are you going to give them a heart rate to not go over? Are you going to be safe and give them a buffer of maybe 5 beats of maybe 10 watts, 15 watts, that so that they're well underneath that first threshold? How do you operate when it comes to specifically giving out that information so that they train where you want them to train? Well,
first of all, I like to prescribe and target their guide their exercise with not just heart rate, but preferably combining heart rate as a measure of internal physiological responses, then their external measures of either power or pace, and finally I stress, and I think this is often the most important and maybe the most overlooked variable, is their perceived exertion. I think that and that's a really key message I try to give to those individuals, that really pay attention to your perceived exertion. If you do exercises in different sports or disciplines, for example, you do some of the training, you do rowing, then you do a bit of running, and then you do a bit of cycling, that would be very typical for a CrossFit athlete. You're going to have different threshold heart rates in all of those sports. You're likely going to have different threshold heart rates, and they can differ by more than people think. Even in quite well-trained triathletes, I can see heart rate threshold for running, which is 30 beats per minute higher than it is for cycling. So there's a really quite a stark difference. When they've trained though, and when they've sort of calibrated their RPE scale to what the effort should feel like, that transfers very well from one sport to the next, or one discipline to the next. So that's also a very good way of looking at, okay, well, my heart rate is higher now that I'm running than it was when I was rowing. I'm in a different position. I'm standing. I was sitting there. Well, but however, this feels similarly easy or hard. So my heart rate is going to be different, but my perceived exertion is the same. I'm likely in the same intensity domain here.
Yeah, and that I guess gets to the point, and I like that you brought the 3 P's together, right? You have the power or performance, physiology, and then perception. Steven Seiler talks about those.
Yeah, his holy trinity. Yeah,
right. Exactly. I think those are 3 very important ways that we have to look at our training if we want to be accurate. But then going a step further, maybe from that discussion that we're having right now, is the importance of perception, the importance of knowing yourself as an athlete. And obviously the data is useful and the tests are relevant and they can help you orient your training. But at the end of the day, you need to learn to know yourself and feel what your body is telling you. A great line from Niels van der Poel's training manual, I think, was you have to learn to listen to your body when it's whispering to you, so that you don't have to hear it scream at you. I think was I'm paraphrasing, but it was something like this, and I thought it was very insightful coming from him in terms of know yourself, right? Learn to obviously measure your physiology, know what your body can do, but then learn to listen and know what those signals are that you can pick up as a human with what you have between your 2 ears and the rest.
And when you can listen to your body well, and you can compare your heart rate to your RPE, to your power or pace, then you can also monitor your sort of training status really well. And this is also a reason why I encourage using RPE, in that if we do sort of you've trained hard, maybe a bit harder than usual for a couple of weeks, and maybe there's been a bit more volume, quite a typical response there is that you start seeing lower heart rate numbers for the same power output or pace. Does that signal that you should go harder? No, it doesn't. If you look at it, or typically it doesn't. You should also think about how you're feeling, and quite a typical response there is that I'm feeling a bit tired. It's starting to feel like a bit of effort in my legs, and the very typical description is, I can't get my heart rate up. Well, that's a very good reason for you not to try to get your heart rate up, but go easier. If you can't get your heart rate up, it's saying that there's an autonomic imbalance in terms of your nervous system, and you need to let the sympathetic side rest for a bit.
That makes a lot of sense. Let's go to endurance sport athletes. They obviously need some hefty volumes of moderate intensity training. So how might that vary from, let's say, competitive cyclist to obviously a rower? I know the time domain is quite short, but you still need quite a bit of volume there. So maybe talk about those 2 populations to begin with, since you have experience in both. How does the endurance work look similar or different between those two groups?
Well, if you look at elite endurance athletes, it doesn't really matter whether their competition lasts 6 minutes or 6 hours. They're going to be doing about a similar volume of training, and they're going to be spending the majority of that training time in their below their first threshold. That's something that's quite universal across elite endurance athletes. Runners do a bit less volume typically because their bodies can running the impacts are much higher there. So stress injury risk gets bigger with training volume increases there. But in terms of, well, you said rowing, cycling are typical sports where there's fairly low impacts on the body, and you can really just train as much as your physiology allows you to train. Then yeah, you'd see quite similar training in terms of what the athletes do in their base endurance. At least if you look at it from a sort of large perspective of how much time are they spending in their sort of zone below the first threshold. But then when you start teasing it out, there maybe you start seeing slightly different types of patterns in how much training you do at very low intensities and how much training you do a bit closer to your first threshold. But even there, I'd say that the distinction seems to be generally that as individuals and athletes get fitter, their most of the bulk of their endurance training moves a bit further below their first threshold.
Okay, so if I understand what you're saying here, is that maybe if you have less time, no, I don't want to say that because then people are going to want to go harder because they have no time, and it's not the point. But if you're doing a lesser volume of low intensity work, you might be a little bit closer to that first threshold. And then if you're doing substantial amounts of that low intensity work, you're just to stay in the right area, stay in the right zone, quote unquote, and have the right adaptations that are going to come from the work, you might want to be significantly under that first threshold, just so that you can just tolerate the volume.
Yeah, that's one angle, and I think the other, perhaps even more important angle here is that if you're fit, your thresholds are going to be at in absolute numbers, they're going to be at high power outputs, high running speeds. So say that for an elite cyclist, the first threshold is probably in the range of 300 to 350 watts, depending a bit on the size of the individual. For runners, their first threshold is probably 16 to 17 kilometers per hour, and in some instances even higher. And then if you just start considering, for example, the energy demands of fueling workouts at that intensity, you say a cyclist doing 6 hours at that intensity, even though from sort of physiological perspective, it's not necessarily, it doesn't look that taxing for them. I can tell you they will tell that it's quite hard, even though they're still below that threshold. And then when you just start looking at the numbers of how much energy they consume during workouts like that, it becomes a real task to fuel the athlete to do that day in, day out.
Yeah, I can imagine that working at 300 plus watts for any period of time cannot be fun, no matter how fit you are. Okay, that was a really great run through of all the ways to apply that those different endurance interventions with different populations. Now, one thing I wanted to talk about was vascular control, and as it relates to something like critical power. We know that critical power is highly correlated to type 1 proportion of type 1 fibers, but even more strongly to capillarization of said fibers, or capillaries per fiber. I forget what the exact terminology was. And like I mentioned before, one of the reasons I've kept the 1 minute breaks in the step test that I do is to see the reoxy slope on the moxies. And one thing that I've noticed is that the peak reoxy rate keeps climbing until about critical power, and then it levels out, and then it stops going up. Does that mean anything to you in terms of vascular control, in terms of vasodilation capacity, and how as it relates to critical power?
Well, at the present, no, but hopefully in about a year or two, it will mean something to me. What I mean by that is that currently it's been almost 3 years since I properly used the NIRS device during tests, but I'm going to start using them a lot more in a few months relating to our ongoing or starting study projects. And why I think that we are going to get insight into that is that we're looking at NIRS, and there we can look at the tissue level oxygenation responses, but we're looking at other variables. So we're doing a cardiopulmonary exercise test. We're looking at we're also adding impedance cardiography there, meaning that we can monitor cardiac output, stroke volume, ejection fraction, etc.
Yep.
And what this means, that what we're actually trying to do is we're trying to break down the components of the VO2 max into its separate parts. This is something that then in one of Mark Burnley's videos on his All Out Physiology channel, there's a very nice explanation of Peter Wagner's model for oxygen consumption, which basically combines two different aspects. It combines first it has convective oxygen delivery, which is the basic Fick principle. So oxygen uptake equals cardiac output times arteriovenous oxygen difference. That's actually something that we can very easily calculate with our methods, because we can measure VO2 and we can measure cardiac output with impedance cardiography. So then it's just a matter of dividing VO2 by cardiac output, and there's arteriovenous oxygen difference for you there. But that's just one of the determinants of oxygen delivery in Peter Wagner's model. So then the other part that you have there is diffusive oxygen delivery, and basically your VO2 max is going to be at the point where the convective and diffusive lines intersect. Why that relates to your question about the capillary to fiber ratio is that we think that the diffusive component is quite strongly correlated to muscle capillarization, and increased capillary to fiber ratio increases the diffusive part of oxygen delivery, and so we're going to be looking at that. But we will have our NIRS device measures at the same time, so maybe I will learn to see something there.
Yeah, looking forward to learn more about this, but it's always interesting to try and look at those graphs and tease out what they might mean in different situations for different people. Let's go to some Twitter questions. We got quite a few to work through. So here we go. I'm just going to write down Twitter questions. Okay, the first one, I'll get the first two together because they're quite close to one another. The first one from Paul Moreno, difference in lactate curves in different populations and how the determination of LT1 and LT2 varies. So that's question one. The second one from Marco Altini. Hey, Marco. I've enjoyed Elias's thread on the change in lactate profiles. So pretty much the same topic, following different training phases, polarized versus sweet spot. So maybe you can tackle those curves. So how the curves look and what they mean and how they might change with different training interventions.
Yeah. And well, as you said, that those sort of coincide well. I wasn't at a level that I'd consider unfit in any of the tests. That's mainly because I see really unfit people, and I'm still happy to be that I'm nowhere near that. But there was so what Marco's referring to is I did three tests start in I think that was mid sort of in July 2019, then February 2020, and I think May 2020 I did three tests. And preceding the first test, we just had our first we had a newborn baby in January. I was finishing my master's thesis at the same time, and I got a new job, full-time job at the same time, meaning that basically for a couple of months both training and sleep were not optimal or non-existent at times. So that was my sort of low level, and that lactate curve actually represents that in terms of pattern. At least the initial part of the curve is quite typical for what I see in unfit individuals, in that they do not have a plateau in their blood lactate levels when you increase work rate. Instead, what you see is a marginally increasing blood lactate from one step to the next. And there I often like to think that the initial target there is not necessarily to find a higher threshold number, but to just flatten the curve there, make sure that you have a plateau there at the initial level. And even though if you determine the threshold, it might not be at a vastly different level, you see much better metabolic control there. And that also normally manifests in increased fat oxidation rates. Mm-hmm. So that's also looking at unfit individuals. I'm not a fan of the baseline or lowest number plus 0.5 or those kinds of numbers. They tend to basically, often I'd had to define the threshold a bit sort of absurd low values. There, I think better method is to look at where the rate of increase shifts. So you can see that first there's a sort of flat, slow increase, and then it changes to a bit of a steeper increase. Mm-hmm. Again, that normally matches very well with where I determine VT1, so ventilator threshold 1, where I look primarily at the increase of in carbon dioxide production relative to oxygen consumption, but also ventilation related to oxygen consumption. Mm-hmm. So then when you move from unfit to fitter individuals, what you start seeing is that the initial portion of the curve is flatter and the values stay lower there. Well, you might expect that given that the initial values were higher for the unfit individuals, they'd also reach higher values at the end of the test, but that they don't do. Instead, what you see is that the curve, or not a curve in this instance necessarily, increases moderately, but you also don't see a point above the second threshold where you start really reaching high numbers. Instead, you end the test at relatively low blood lactate numbers, and in my opinion, that's not due to the fact that they haven't properly exhausted themselves, but it's just their physiological state in that point.
Yeah, that makes sense. Just like you were saying before, when somebody's maybe overtrained, you might see a compressed. I want to see a compressed kind of range where it's high to begin with, but it's not that high when it ends, rather than being very low when it starts and maybe very high, depending on the profile, obviously, when you end. Does that make sense?
Yeah. I think that's what I was trying to get at also. Yeah.
Okay. Yeah, you can keep going on we had lactate curves. So how the curves look and how it might change with different type of trainings.
Yeah. So the second, I think I'll again go here to my second lactate curve and training, mm-hmm. which is representative of quite a polarized approach to training. Sorry, Marco, I don't have exact numbers of my training volume. Didn't have time to go through my old training data for this podcast. But basically, what I was doing was doing 2 to 3 sessions below the first threshold per week, and then I was doing one high intensity session typically per week, and that was done above the second threshold. So a very, very clearly polarized approach to training, and that's also, so what you see in the graph there is that I have there an initial much clearer plateau in the blood lactate curve. The base endurance training has paid off in those terms, mm-hmm. But what you also see is that I reached quite a high peak blood lactate curve number. I think mm-hmm. that was in about 20 millimoles per liter in that instance, and that's what I'd consider a typical and probably a fairly good shape of the curve for someone who's targeting short endurance events, say rowing, which is roughly a 6-minute race, or a 1.5 kilometer track runner. I mean, or something like that. That's probably what you'd want to see, or what I like to see in those instances, in that they have a good solid aerobic base, efficient aerobic metabolism, but when they really need to turn their glycolytic energy production on, they can also do that and reach high blood lactate numbers.
Yeah, and if we compare that to someone who's maybe competing on longer events, I guess you would still want to see a very flat line at the start, very efficient, try to go obviously push that inflection point as far as possible to the right, but then you might not see as high absolute values simply because that's not where their bread and butter lies, right? We want them to know how to sprint, obviously, but they don't have to be able to produce the same amount of power on a short time domain, like you said, like a sprinter or a rower might need to.
So yeah, for example, Ironman athletes come to mind. Well, sometimes obviously their races might come down to sprints, and they do come down to sprints where they might wish that they have a bit of sort of the high end glycolytic capabilities for that, but quite typically you'd see fairly low peak blood lactates in those instances, because they don't really have to or need to, and they really shouldn't be spending that much training time improving their glycolytic capacity or power.
Yeah, that makes a lot of sense. I've skipped one or two questions, guys, just so you know, for those who asked, and if we didn't cover them because we covered in depth, I'm talking about specifically here how to determine threshold 1 and what values to look at. I think you've expanded on detail on that. Another, maybe a practical case here that we can look at Velo Power asks, what would be good training interventions for people whose LT1 is relatively close to LT2? He talks about LT power being at 90% of LT2 power. And then he also talks about power around LT2 is at 89% of 6-minute power, quote unquote VO2 max power. So the range on the right seems small. Note LT1 is already rather well developed. So how would you approach such a case? What would you recommend? Obviously, we maybe don't have the details of what event that person needs to compete in, which might give us some further indications on what they need to work on. But if you don't have that information, just given their physiological profile, what would you say they need to work on?
Well, at first, as you mentioned, there are a few considerations you'd want to know. First of all, what are they training for, and also maybe how they've trained before, and then also the absolute values matter a bit also, and sort of training history. So in that instance, I'd say that if it was, say, a masters athlete in some sport, we know that with age we start seeing sort of our VO2 max drops a bit faster than our threshold values, so we start seeing higher thresholds relative to VO2 max. If that was that kind of an instance, and perhaps their 6-minute power or VO2 max value is not particularly high, in that case, I would recommend maybe going for a slightly more polarized approach in their training, meaning that they have to improve their VO2 max. They have to get their ceiling higher so that they can then build the thresholds higher again. Because I mean, and we know that we don't see thresholds at 100% of VO2 max. The VO2 max has to be higher than the thresholds. So if that, in that case, VO2 max might be a limiting factor for your threshold improvement. On the other hand, if we're talking about an elite endurance athlete whose maximum power output at the end of the test or for 6 minutes is 600 watts, or they can 500 watts, sorry, or they can run for 24 kilometers per hour, their VO2 max is 85, then maybe telling them that they need to improve their VO2 max is slightly missing the point. They probably can't improve their VO2 max at that point. They've reached their genetic maximum. So right. So again, context is key.
Context is key. Yeah. I want to finish with this question by David. It's a question that I like to ask usually at the end of the podcast. So thank you, David, for asking it for me. David says, please ask Elias what he would like us to know about his research and recent study that interest and excite him.
Yeah, well, I partly alluded to that already when I was talking about the Wagner model for VO2 max.
Mm-hmm.
That's something that I think is really exciting, because so far it's been quite difficult to non-invasive, or I don't think you can say non-invasive if it means that you do a maximal exercise test and you put a bunch of measures on, but relatively speaking, invasive methods, we don't have to catheterize anyone or do any invasive measurements in that sense. We can do fingertip samples and then just mask on electrodes on. But we're looking at, in a non-invasive way, of determining both the convective and diffusive components of oxygen consumption, and I think that's something that's going to be really interesting to look at. And we're doing that in the context of looking at, I will be looking at both acute responses to hypoxia, so high altitude, and also heat and hot environments, and then also a combination of altitude and hot. But that's alongside the main task of what we're looking at is we're actually looking at chronic adaptations in endurance athletes, and we're particularly looking at how we can optimize returning from a high altitude sea level. We know there that one of the main reasons why we do high altitude training is that we want to increase our total hemoglobin mass or red blood cell mass in our body, because that's going to improve oxygen delivery to working muscles, and thus it's going to improve endurance performance. But we know the way to achieve that. We know that by going to high altitude, spending at least 3 weeks at least in the range of 2,100 meters to 2,500 meters above sea level for at least 3 weeks, we know that we see typically, though there's large individual variation, we typically see a 5% increase in absolute hemoglobin mass, and also an increase in VO2 max and performance. But unfortunately, when we come back to sea level, we know that the value will come back down eventually. So we're looking at how we can keep that number and hemoglobin mass high even after return to sea level. And we have a few initial results there where it seems that with sort of intermittent exposure to hypoxia, we can do that.
Interesting.
And those athletes are maintaining their hemoglobin mass much better. Then we get to combine all of this sort of where we look at, we're manipulating or we're altering their oxygen delivery, and then we can look at how that actually affects their performance, and then we can combine that with the Wagner's model and look exactly what happened there. And I think that's all going to be quite fascinating.
Yeah, well, I think we're all looking forward to seeing what comes out of those different lines of research. Elias, I want to thank you for taking the time to come on the podcast and chat for more than an hour and a half with me here. For people that want to learn more, maybe get in touch with you, where can they do that online?
Well, Twitter is where at least I think most of your audience is non-Finnish speaking. So Twitter at Elias Lehtonen. If you are Finnish speaking, then I welcome you also to follow, and anyone else. But the content is mostly in Finnish. But on Instagram at Helsingin Urheilulääkäriasema. All right. Is the page there. If you want to book consultations or such, then you can actually do that by getting in touch with me via Twitter or email. I do also not just testing, but also physiological consultations at our clinic. So fantastic. That would be Twitter or then email elias.lehtonen at hula.fi.
Okay, great. Well, I'll put those links in the description, so anybody interested in getting in touch with you, they know what to do. Elias, thanks again for coming on the podcast. It was a lot of fun.
Thanks, it was a pleasure.
Thanks for listening to this episode. If you would like to support the podcast, please take a few moments to leave a written review and a 5-star rating on Apple Podcasts. If you want to watch this episode again, you can find the full video recording on my YouTube channel. You'll also find hundreds of hours of free content, all my podcasts, my thoughts of the day, structured presentations, and more. So don't wait, go subscribe, and I'll see you in the next episode. Take care.